Hello, I'm Dr. Marc J Gannon, the director of the Low Vision Institute in Fort Lauderdale, Florida. Today we're going to talk about nutrition. I want to give you some ideas of things that can be done to assist the retina and the macula in maintaining optimum health and function. Macular degeneration occurs because of a loss of nutrients and oxygenation to the tissues of the retina. So what we want to do is maintain the highest levels of nutrients and oxygen getting to those macular and retinal cells so that we can keep them intact and functioning for the greatest period of time. A lot of the conditions that we're dealing with are genetic and hereditary. And when we're dealing with macular degeneration in particular and diabetic retinopathy, there are certain things that we can do that are environmental or that are within our control beyond genetics to assist in maintaining the condition and stabilizing it and keeping the progression at bay. And those things involve smoking as being the number one thing that causes a loss in these particular instances. Smoking increases the incidence and progression in macular degeneration by more than 28 times. It's the single worst thing you can do. So if you do smoke, it's one thing you want to cut out immediately. You want a diet that's high in fresh fruits and vegetables, especially green leafy vegetables like spinach and kale. Other diets that are high in fats and triglycerides, again, block the absorption of nutrients from the macula and from the finer tissues in the body. So you want to eliminate large quantities of triglycerides, simple sugars, and fats from your diet. You also want to protect yourself from ultraviolet light. UV is one of the worst lights for the retina, the macula, and for the lens inside the eye. So to reduce the progression of those conditions and cataracts, you want to protect yourself always from UV light. And that can be done with ultraviolet sunglasses or with just an ultraviolet coating over a clear lens. In any instance, it's very important to protect against UV. You also want to make sure that the tissues get enough oxygenation. So exercise is very important, especially something that's aerobic. If you can't walk, move your arms. Anything that you can do that will improve circulation and respiration will be a benefit to the tissues in the eye and the macula as well. And you also want to have ways to protect yourself from deterioration in the finer blood vessels in the retina. And one of the things you can do, as strange as this may sound, is drink a little bit of red wine every day. Red wine has rutin. You can also take rutin as a separate supplement, which is fine. But what that does is it refortifies the vascular walls of the microvessels in the retina and keeps them intact. So it helps, again, retard the progression of macular degeneration. That particular instance is something that has to be done over time. So if you have a family history of macular degeneration or related conditions, and you're in your 40s or 50s and you enjoy red wine, drink 4 to 8 ounces a day. It's not a bad thing. It works out very effectively. As you're older, if you start drinking it, it won't affect it quite as well as when you're younger for those particular levels of benefit. We also want to supplement our diets with appropriate vitamins and minerals. And vitamins and minerals are kind of tricky when we're talking about taking them. Years ago, the government did a study in 1950, and they determined that if we ate 18 different fruits and vegetables every day and a total between them of 20 servings, we'd get all the vitamins and minerals we need. That actually amounts to about 9.5 pounds of fruit and vegetables a day, which of course is way beyond anybody's ability to eat. So the government at that time decided, let's see if we can find a way to take some vitamins and minerals out of the fruits and vegetables, which is where they all come from, and encourage people to eat some fresh fruits and vegetables every day. So the thought at that time was to eat 3 to 5 servings of fruit and vegetables a day and supplement with vitamins. At that point in time, we were able to extract 8 different vitamins and minerals cost effectively. And if you remember 1-a-day vitamins and similar preparations, those were the vitamins that we all needed to take because they were the ones that we could cost effectively take out of the fresh fruits and vegetables. As time went on, we got better at doing it. And now we can take 18 different vitamins and minerals effectively out of the fruits and vegetables, which again is better than it was before. But an apple has 12,000 micronutrients and a tomato 10,000. So when we extract 8 to 18 of them, we're missing the greatest bulk of the nutrition that is really present in the fruits and vegetables. And the micronutrients are there to provide absorption and bioavailability to the main nutrients. So when we remove them, we decrease the effectivity of the other nutrients tremendously. A good example of that is lutein. And lutein is very important for maintaining macular health and for the retina. And there was a study done several years ago in Chicago by Dr. Richter, And that particular study denoted that if we ate 6 milligrams of lutein a day in the form of a capsule, we would increase our blood serum levels by about 5%. If we took 15 to 20 milligrams of lutein a day, our blood serum levels would go up almost 10%. But if we ate a fresh cup of spinach, which had 2.4 milligrams of lutein in it, blood serum levels went up almost 44%. Even though it was a smaller amount of lutein, it was more bioavailable to the body because the micronutrients were present. Very important. There are supplements out there, such as Juice Plus, which is basically a whole food supplement. And what they did was, instead of removing the vitamins and minerals from the fruits and vegetables, they simply removed all the salt, the water, and the sugar, leaving all the micronutrients intact. So essentially, you're eating whole foods or getting the full content of those 20 servings of fresh fruit and vegetables every day by taking a couple capsules. This is a far more effective way of supplementing the nutrition that you need for maintaining good health, not only in the macula, but in your entire body. We also find that other nutrients are very beneficial as well. Omega-3 fish oils help tremendously to preserve the integrity of the cells in the macula. Coenzyme Q10 helps oxygenation to the tissue in the macula and the retina, as well as the heart. So those are also supplements that you would want to take in addition to those that we've mentioned. Taurine is also a very effective antioxidant utilized in the uptake of these nutrients in the eye. So supplements that incorporate all of these things are excellent. A new supplement called Tozol was just released, and Tozol, when taken in conjunction with coenzyme Q10 and omega-3 fish oils, and in addition to a whole food supplement, would give you the greatest benefit all the way across the spectrum of a full comprehensive program of nutrition for macular degeneration and other eye conditions. So it's very, very important, again, to eliminate those factors such as the smoking and diets that are high in fats and triglycerides, or diets that are high in alcohol too. A lot of alcohol is also detrimental to the macula. So you want to make sure that we keep all of those things that are within our control, and thereby stabilize the condition and decrease the progression as much as possible. So I'll leave you with the thought that there is a lot of hope for patients with macular degeneration, and there is new hope in sight in maintaining a constant, healthy level of vision. Thank you very much.